According to the World Health Organization, up to 3.5 billion people lack access to the healthcare they need. Healthcare is essential for the well-being of the communities around the world. However, achieving a good healthcare system is really challenging due to the problems of our world. After listening to my speech, you will be able to identify the elements that make a healthcare system successful, healthcare systems around the world, and some of the problems that countries may face. When I moved to the US from Turkey, I expected a high-income nation like the US to have a better healthcare system. However, after some time, I came to the realization that the wealth of a nation does not directly correlate with the quality of its healthcare. So a quality healthcare system must take many aspects into consideration. Since 1946, the right to health has been recognized as a fundamental human right, and for everyone to have access to this right, a healthcare system must provide accessible and affordable healthcare that is equal. Patients' needs need to be the focus rather than providers. To begin, making healthcare systems will help break the cycle of poverty and encourage people to seek medical attention. However, global challenges like the pandemic or climate change might make it challenging for countries to make healthcare more accessible, and this results in different healthcare systems around the world. So there are four types of healthcare systems around the world, which differ mainly in how they are funded. Here is a visual aid showing certain examples. The UK and New Zealand use the Beveridge model, in which the government funds the services. The Bismarck model, which is used by France and Germany, is funded jointly both by the employers and employees, and it also ensures citizens have healthcare insurance. The system in Canada has elements from both of the systems I talked about, and the systems make healthcare accessible to everyone. Lastly, the out-of-pocket model is common in developing countries, where each individual pays for their own medical bills directly. Even though each model aims to make healthcare accessible, none of them are perfect. The state-funded models have long waiting lists, and some of the models, such as the Bismarck and individual payment models, force people into poverty. Now that you know the four types of healthcare, I will describe another one that is used only in the United States. America's healthcare system has elements from all four types I talked about. It is a combination of private and public components. Health insurance can be purchased privately, or it can be provided by the government into certain groups. According to the OECD's health statistics from 2023, the US spent about $12,000 per person on healthcare, which is the highest among other countries. However, this does not mean that America's health outcomes are the best. According to the same data from the OECD, the United States spends more on administrative costs, but less on healthcare, which results in higher suicide rates and lower life expectancy. As you heard, each country faces their own challenges in an effort to serve healthcare. In conclusion, crafting an effective and accessible healthcare system that also ensures equality is a current global challenge. As our world progresses, it is important to acknowledge the limitations of the current healthcare systems, and we should always strive for better ones that prioritize the well-being of all communities worldwide. Thank you for listening.